Dave Smith from Turning Point. Dave, over to you.
Hi everyone. Yeah, my name's Dave. I'm actually really excited to talk here today because I actually started my journey in volunteer work back in 2019 in Bristol for several organisations, one in particular around substance misuse. And I've now been doing my dream job for 3 months now. So I'm yeah, so you know you can get to where you want to be through volunteer work. So today I'm just going to give you a quick overview of how how Turning Point works, what services we offer. So I sit on the engagement and prevention team. Turning Point Impact is Swindon and Wiltshire's commissioned substance misuse service. We work across Swindon and Wiltshire, and we have hubs in Trowbridge, Salisbury and Swindon, as you can probably see in the background. And I'll just say that I'll move out of the shot at the end so you can take any contact details down that you need. Currently, due to COVID, we're doing most of our work online and over the phone. We do invite people in for prescribing reviews and let people use needle exchange, that kind of thing. We work with all different substances and people from all different backgrounds. A big misconception about our clients is that often they are hedonistic and they use substances for fun, or but a lot of our clients have experienced childhood traumas and are self-medicating. So we work in a non-judgmental way and inquisitive and work towards people's treatment goals. We offer a number of treatment pathways. So we offer, our first one is opiate and crack users pathway. For people to use opiates and crack, as very specifically moving crack away from cocaine. We have our alcohol dependent pathway. We have our non-dependent alcohol pathway. We have our reclaim pathway, which is for any other substances other than opiates, crack and alcohol. And we have our harm reduction pathway, which is for clients who might just want to use the needle exchange or just get non-structured treatment and advice. So as I mentioned before, I'm on the engagement and prevention team. So we facilitate drop-ins in the communities and at festivals, offering harm reduction advice and services such as the needle exchange. We also facilitate training workshops, presentations, drug awareness and service overview presentations like the one I'm doing now. And we also manage a caseload of clients on treatment requirement orders from the courts, such as alcohol treatment requirements and drug rehabilitation requirement orders. So we work closely with probation to offer this treatment specifically to those clients. We also have our clinical team, which deals with prescribing opioid substitution therapies such as methadone and aspirinol. They also deal with nursing matters such as wound care around abscesses and infections around injection practice. We also have the recovery team. So once you've been referred to our service and been assessed, we'll then put together a care plan, person-centered care plan and risk assessment with the client to decide on what treatment goals they want to work to and put them on a treatment pathway that suits them. So due to COVID, a lot of our groups and group work and workbooks and everything has moved online and over the phone. So for especially for our most high risk clients, such as our opioid and crack user group and alcohol dependent clients, the group work has moved online for that one. And we offer some one-to-one workbook facilitation over the phone with key workers due to barriers to treatment, such as access to devices or social anxiety around groups. For our lower risk clients, we have developed our online platform, MyTP, which is now offering more pathways than before. which include our reclaim pathway for clients other than opioid, crack and alcohol. We have our understanding my drinking pathway for clients who are non-dependent alcohol clients. And we have our mindfulness-based relapse prevention pathway for clients who have reached their treatment goal and are looking for tips and techniques on how to manage relapse and prevent relapse. Once our clients have reached their treatment goal and maintaining abstinence, we also have our Get Connected team, which is Turning Point's social prescribing team, which the way I like to put this is it's for some of our clients, it's an opportunity to rebuild their lives and reconnect with society. So this could be gaining new skills and employment, or finding hobbies and meeting new people. We also have our peer mentor and volunteers team, which support people to, so in particular the peer mentor team. So once we've got a client who's been through treatment and achieved their treatment goal, and maybe they would like to support other people who are going through similar issues, they can sign up to be a peer mentor. And we also offer volunteers as well. And I'm currently working with a volunteer who's doing really well at the moment on drop and in hubs. Excuse me. So just very quickly, the easiest way to make a referral is by using our online form. There's two online forms. One is our self-referral form for anybody wishing to make a referral for themselves. Our second form is for a professional to make a referral on behalf of their client with their consent. You can also make a referral by emailing impactreferrals@turning-point.co.uk, or you can telephone us to discuss a referral or attend one of our hubs. This isn't our preferred method, but we won't turn anybody away that hasn't got access to a device or telephone. So I'm just going to open it up to any questions, and I'm just going to step out of the screen. So hopefully you should be able to see the contact details to make referrals and get in contact with us.
Thanks very much, David. That's a fantastic presentation. The first question. Are you gonna?
Yeah, I can hear you.
Cool. So the first one's come up on the chat, so I'll read that out to you from Shirley. Thanks, David. Do you also work with people who are suicidal as a result of continuous substance misuse? Do you have any pathways on help with suicidal thoughts?
So this is a really difficult one with substance use, actually. We do have referral routes for IAPT, and I'm just going to be honest, I've forgotten the name for the other one, for clients who have more risky situations. But just in terms of substance use, we have some real difficulties in terms of dual diagnosis. So clients who have a mental health treatment need and also a substance misuse treatment need. Quite often our clients will go to receive mental health treatment needs, for past traumas, and be told because they also have a substance misuse treatment need, or potentially not even a substance misuse treatment need, but are using substances, or they are often bounced back to us to engage with treatment with us. So this is a very difficult situation for us to deal with, because quite often we recognise that a lot of our clients have a mental health treatment need as well as a substance misuse treatment need, but we're not equipped to deal with that. We're trained on trauma-informed approach and motivational interviewing, and we have lots of skills like that we can support people with, but we're not qualified mental health workers as such.
Excellent, thank you for that, David. Teresa.
Hi, David. Just want to know if you've got any pathways to support families that might have somebody within the family that's misusing.
We do indeed. Yeah, we do. We do have a team that supports. I mean, a lot of our colleagues will be able to support families with this, but we do have a specific team that supports people with this. Yeah. And it's a really important part of this, because we do recognise that often it's difficult for families maybe even to understand the reasoning behind and need extra support to manage these situations.
Thank you very much. Someone's asked for the email address, and I've put that in the chat, which David, correct me if I'm wrong, it's impactreferrals@turningpoint.co.uk.
Yeah, that's our referral route. Yeah, you can contact us there. I'm not too sure. I think there is potentially another one. It's potentially info@turning-point.co.uk, but don't quote me on that one. Sorry.
Yeah, I won't correct you on that one. And well, one more question's come into the chat is, would you be open to working collaboratively with a social prescriber in a GP surgery, such as doing joint appointments, if a patient is open to getting support, but is hesitant? Happy to discuss. This is Caitlin. We might have to put the email there, Caitlin. But is there any thoughts on that, David?
Yeah, so we do a lot of collaborative work, actually. Like in my role in particular, I do a lot of collaborative work with the probation team. But yeah, we will work with any professionals to support our clients to achieve whatever goals they might have, and if they have any anxieties and might need extra support, you know, from a doctor or support worker or anything like that, we're more than happy to work collaboratively with them.
Okay, Caitlin, Caitlin's put her email in the chat box, but Caitlin, I do suggest you take David's email, which I put in there, and contact him directly as well. Fantastic. Caroline.
Yeah, just a quick question with regards to supporting carers of people who misuse drug and alcohol. If the person themselves isn't engaging with Turning Point, would Turning Point still support the carers?
Yeah, as far as I'm aware, I think because it would fall under the different teams. So yeah, I can't see any reasons why not, because this is the thing, a lot of our clients might not want to engage. So we have people who might come in and have an assessment and decide that they might not want to, and then the family decides that they do need extra support, and also that would be a good point of contact if the individual wanted to then engage later on. You know, obviously we'd have all the information there and know what was going on. So that would be, we could definitely do that.
Great, thanks for that. Any more questions? Okay, well, on that note, David, thanks so much for joining us, and you know, for those you know, for the great presentation and for answering all those questions. Clearly something that, you know, is very important.